Infrastructure, which has evolved over the past 6 decades, guarantees its people high-quality medical services. Health achievements include a low rate of infant mortality, child health programs, preventive medicine, and a large number of doctors. The island has for years trained medical students for different nations and offered specialized medical services for foreign patients.
Cuba has always assisted any patient needing treatment here, no matter what country they come from, because ours is a humane program open to all those who need our medical services.
Some 28,000 Cuban health specialists are currently working in more than 60 nations around the world, according to the Cuban Health Ministry. Some medical missions are Cuban-sponsored, while others are funded by the countries receiving the services, a financial contribution to the Cuban economy and its free public health system. We are all very eager to give our help and solidarity to other nations, so our joining of international missions is a voluntary action. And so we are also helping our country improve its economy. The purchase of all this medical equipment here and the hospital repairs are done thanks to our international missions. Over the past year and a half, Cuban doctors have been forced out of several Latin American countries, including Brazil, Ecuador, and Bolivia, for allegedly supporting political opponents. It's a move openly backed by the Trump administration.
The Bolivian government announced Friday the expulsion of hundreds of Cuban officials for their country. It was the right thing to do. Cuba wasn't sending doctors and officials to Bolivia to help the Bolivian people, but rather to prop up a pro-Cuba regime headed by Evo Morales, who sought to maintain his grip on power through electoral fraud. Bolivia now joins Brazil and Ecuador in recognizing the Cuban threat to freedom.
Cuban doctors say the U.S. is interfering with medical assistance. These doctors have fought Ebola in West Africa, and some have fought other natural disasters such as earthquakes, floods, and we come to bring our solidarity for the human commitment that we keep with our profession and with our country and the world. Cuba has thus far sent medical brigades to over a dozen nations in Latin America, the Caribbean, Africa, and for the first time Europe, while more Cuban doctors and nurses are ready and willing to offer their modest contribution to other countries fighting COVID-19. Luis Chirino, CGTN, Havana.